PPT Eye and Ocular Adnexa MCQ Part 1. An extracapsular cataract removal is performed on the right eye by manually using an iris expansion device to expand the pupil. A phaco-emulsification unit was used to remove the nucleus and irrigation and aspiration was used to remove the residual cortex, allowing the insertion of intraocular lens. What code should be used for this procedure? So, let's go through the four codes. Adyam 66982. It is an extracapsular cataract removal. And 82 and 84 are extracapsular cataract removal. 83 is intracapsular cataract extraction. 85 is insertion of intraocular lens prosthesis. So, the first line itself is extracapsular cataract removal. So, we can remove what? 66983 and 985. So, we have two codes left, 984 and 982. So, again, if we are going through the codes, there is intraocular lens prosthesis in both. And here we can see an iris expansion device. And in the code 66982, we can see iris expansion device. So, the answer is 66982, C. Answer is C, 66982. Next, a 65-year-old patient presented with ectropion of right lower eyelid. Reply with tarsorrhaphy excision is performed for correction. Attention was then directed to left eye. Patient also had an ectropion of the left lower lid, which was repaired by suture repair. So there is four codes also. Here there is an ectropion. So if we go through this code, we can see 67914 to 917 ectropion and 92122 are entropion. Here the ectropion word can be seen, so we have to cancel this part. So ectropion codes are 67914, 151617. Here there is two codes, 14 and 16. It is suture, excision, tarsal wedge. So we have to go through the codes. Here we can see the word tarsal wedge excision. So we can go with code 67916. But option A and B are having 916. So two options are having 916. So we have to double check the question. 67916 is excision tarsal wedge. 6794 is suture. And if we go through these two codes, these are two different eyelid. E2 is left lower eyelid and E4 is lower right eyelid. So, ectropion of the right lower eyelid. Right lower eyelid is E4. E4 there is 67916. So, E2 lower left eyelid. What we can see? There is a repair by suture. So, we have to use the code 67914 also. So, the answer is 67916 and 67914. Next, a 63-year-old woman presented to eye clinic as a new patient with symptom of flashing light and floaters in the right eye for 2 days duration. The ophthalmologist does a general evaluation of the complete visual system, including dilating her eyes and checking her indirect ophthalmoscope, revealing peripheral retinal tear. The physician explained to the patient that if left untreated, there is a high likelihood of retinal detachment. The patient agreed to the procedure. The physician lasers the retinal tear and tells the patient to come back in 24 hours for follow-up. Code this visit. So, these are the codes. ഏതെല്ലാമാണ് 66820, 821. This is for cataract. 67141 is for prophylaxis. 67208 is destruction. So, what is the question? Can't find any cataract. cataract question കാണാത്തത് കൊണ്ട് we can remove 66821 this code. Okay, now we have to find whether this is profile axis or destruction. So അപ്പോൾ നമ്മൾ ഒരു കോഡ് റിമൂവ് ചെയ്തു. ഇനി whether it is profile axis or destruction. Anyway, here the physician laser the retinal tear and tells the patient to come back in 24 hours for follow-up. So follow-up ഉള്ളത് കൊണ്ട് തന്നെ it is more than one session. Okay, and laser ആണ് ചെയ്തത് കൊണ്ട് it is photocoagulation. What is the difference between these two codes? Whether profile axis or destruction. So we can see the ophthalmologist does a general evaluation of complete visual system, including dilating her eyes. We can see here peripheral retinal tear. Retinal tear എന്ന് പറഞ്ഞാൽ എന്താ? Tear is a break. So retinal break. So we have to go to which code? 67145. Again, we can find what? 67145 B ilum D ilum ഉണ്ട്. So which code we have to use? What is 92004? It is ophthalmologic service, medical examination, evaluation with initiation of diagnostic and treatment program. It is comprehensive, new patient. So ഇത് എന്താണ്? ENM code ആണ്. Modified 25, significant, separately identifiable evaluation management service. So the answer is B. Code 92004 is coded to report the evaluation of complete visual field. Patient is a new patient. Evaluation of eye was performed in addition to performing procedure. Procedure ne kude ഒരു eye evaluation kude നടന്നതാണ്. Also we have to use modified 25. Next, a patient present to emergency department with complaint of painful eye. Patient state that her right eye is constantly tearing and is sensitive to light. Physician perform an exam and identify a corneal foreign body in the right eye. Utilizing a slit lamp, the foreign body is removed. Code encounter. So, ഇവിടെ procedure foreign body removal ആണ്. And we have two set codes. External eye, intraocular. Both sets foreign body removal തന്നെയാണ്. We have to find where it is. Patient state that her right eye is constantly tearing, sensitive to light. Physician perform exam, identify the corneal foreign body in the right eye. So this is a corneal foreign body. So corneal foreign body വരുന്നത് എന്താ? 6520 and 222 ആണ്. Okay. This is or with slit lamp. Use a slit lamp. So the answer is 65222 and RT means right eye. Answer is C. 65222 RT. Next, a patient with Bell's palsy is unable to squint, blink or close her left eyelid. To protect the eye, Dr. Rizia completes a temporary tarsorrhaphy with a frost suture technique. How would you report this procedure? So, what is the procedure? It is a temporary tarsorrhaphy with a frost suture technique. ഇവിടെ കൊടുത്തിട്ടുള്ള കോഡ് 875 temporary closure of eyelid by suture, frost suture. 7710 is severing of tarsorrhaphy. 840 is excision of lesion of eyelid. 950 is canthoplasty. So here clearly it is mentioned temporary tarsorrhaphy with a frost suture technique. So the answer is 67875. That is left eyelid. Next, a patient had a bilateral strabismus surgery involving medial and lateral rectus muscle. Surgeon explored and repaired a detached extraocular muscle in the right eye and placed bilateral posterior fixation suture with muscle recession. How should you report this procedure? So this is a strabismus surgery and there are two muscle, medial and lateral muscle. And these are the codes for the strabismus surgery and muscle. If you have a confusion, ഏതാണ് horizontal or vertical muscle? Go to a text. You can find Strabismus surgery, horizontal muscle. Horizontal muscle താഴെയാണ് medial or lateral rectus muscle. So we can say these are the horizontal muscle. So by heart ആയിട്ട് ഓർമ്മയില്ലെങ്കിൽ പോലും just go through the text. You can find the answer though. So what? We have the horizontal muscle and two muscle. So we can remove all other code and leave only what? 67312. ബാക്കി എല്ലാ കോഡ്സും നമുക്ക് ക്യാൻസൽ ചെയ്യാം. So 312 strabismus surgery horizontal muscle. And അപ്പോൾ 67312 കൂടെ ബാക്കി കോഡ്സ് ഉണ്ട്. We have to fix which one? So we can go through. This is the add-on code 332, 334, 335, 340. ഇവിടെ രണ്ട് കോഡേ ഉള്ളൂ, 334 and 335. What are they? Okay. And 334 എന്ന് പറഞ്ഞാൽ by posterior fixation suture technique with or without muscle recession. 335 is placement of adjustable suture. So if we go through the question, we can find what? That is posterior fixation. Bilateral posterior fixation suture with muscle recession. So we can code what? 67334. 67334. C. One more code under 67340 RT. So what is it? Strabismus surgery involving exploration, repair of detached extraocular muscle. So we can find there is a repair of detached extraocular muscle in the right eye. So as it is bilateral, we put 50 modifier. RT means right. Answer is C. 6731250, 67340 right, 67334 50.